your baby have a 6-week ultrasound scan and now you're a bit confused with the results of those scans and not sure if baby should be treated for their clicky hips or not? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you how to read the hip ultrasound scans for your little one. And from there, to be able to make an informed decision as to whether your baby needs treatment for their clicky hips or not. So here at My Favourite Physio, we see lots of newborn babies. We often carry out newborn baby checks where we look at baby's neck muscle, baby's hips, and baby's feet. These 3 types of condition often occur in newborn babies. And so if you've been told that your baby has a clicky hip, it's important to have your baby seen by an expert pediatric physiotherapist. Now, recently in our clinic, we had a baby come to us and mom was really confused as to whether her baby should actually have treatment for clicky hips. So medically, that condition is called developmental dysplasia of the hips. And it basically means that baby's hips wasn't well formed at birth. If we don't treat it correctly, it may mean that baby will not have a hip joint to walk on by the time they're 18 months or 2 years old. And by then, it would be too late to try and treat their hips. So, what do the scans mean? We're looking at ultrasound scans for babies simply at how much coverage the pelvic bone has over the thigh bone, which is your femur bone. So in babies, the head of femur is not connected to the rest of the long bone of the femur, so the thigh bone. What we look for is that pelvic bone covering most of that femur head? Now, studies have told us that if the coverage is less than 40%, meaning that there's less than 40% of the head of femur that is under the roof of the pelvic bone, that would mean that a lot of the pelvic bone is not covering the head of femur, meaning that hip joint can pop out easily or is already sitting outside of the hip joint. So under 40%, it means that your baby needs treatment with a pelvic harness. Otherwise, baby will not have a hip to stand on when they're 18 months old. The gray zone is where they say 40% to 50%. So looking at this diagram, if between 40 to 50% of the head of femur is covered by the roof of the pelvic bone, they'll say, we'll watch and monitor and take another ultrasound in 6 weeks' time. Ideal is if the pelvic bone is covering more than 50% of your thigh bone, the head of femur. So if that's the case, then we would consider it to be okay and normal. Now, recently we had a mom turn up to us really confused as to whether her baby should have a harness like this, which is the gold standard way for treating DDH, which is developmental dysplasia of the hips. Now, she brought us some ultrasound scans and she said that the hospital physios actually fitted a harness on their baby, but the physio actually said it's not necessary to have a harness on your baby because your scan results are quite mild. So she wanted a second opinion. She did have the harness put onto baby, but baby was extremely unsettled, and so she came to us the next day. And I'm extremely glad that she did, because when we looked at baby's scan results, one of their hips was sitting at 42%. Now, 42% sits on that gray area, and what they do in the scan is they would also stress baby's hips. So they'll open baby's hips out, and on stress, they recorded the hip to have come out even more, and only 38% of the hip was covered by the roof of the pelvic bone. That means this baby falls right into that red zone when their hips are stressed or opened. That's really bad. It is not mild. It is actually serious stuff. If baby didn't have a harness put on, that baby probably won't have a hip to walk on by the time they're 18 months. And at that point, it would be too late for us to do anything. If we start the treatment right now, baby's hips will deepen. That pelvic bone will get deeper and the head of femur sits in better and gives baby a good hip to walk on for the rest of their lives. So we had to look at the harness. It wasn't fitted correctly. Baby's leg was kind of twisted out, and so baby was distressed. We readjusted the harness, fitted it to suit baby correctly, and advised mom that baby needs 6 weeks of harness treatment for optimal hip development. At the end of 6 weeks, we will be scanning their hips again with another ultrasound scan to see how much coverage has happened and if we need to continue treatment. So if you've got a baby out there who's had a hip ultrasound scan and you don't know the numbers in terms of coverage, but you've been told baby's mild and doesn't need treatment, I strongly urge you to see an expert pediatric physiotherapist, because the consequence of missing the hip that is not well formed is a lifetime of problems. Your baby may end up having surgery, which we could have avoided right now if we treated baby. So if you would like to see one of our expert pediatric physiotherapists, the number to ring here at My Favourite Physio is 02-9790-4233. And if you know somebody out there in your world who's mentioned to you that their baby's had a clicky hip, had some ultrasound scan, doctor said fine, don't worry about it, perhaps like and share this video with them so parents can make an informed decision. Until next time, have a fabulous day. Bye.